Hello, hello, hello. Good evening, everyone. Um, Welcome to Complete Care webinar series, live video series. Ask me anything about hepatitis. The world hepatitis. This is to celebrate the World Hepatitis Day, year 2024. So I have with me here Dr. Masha Gusen, who is going to take us through questions and answers to let us know more about hepatitis. So the tag for today's live series is Ask Me Anything About Hepatitis with Dr. Masha Gusen. Thank you to our viewers, for our viewers that will be joining, for our viewers that already joined. Thank you for joining this live session. And this webinar series, this live session is brought to us by Complete Care. Complete Care is a digital health marketplace which connects users, patients to healthcare professionals within the short period time possible. So I'll be leaving the floor open now to Dr. Mashak to give us a brief summary of what hepatitis is. Dr. Mashak, please, you can join me. Thank you.
Thank you very much, Bisola. Um, really grateful for giving me the opportunity to speak on hepatitis. Thank you, viewers. Thank you, listeners. You're welcome to another edition of a webinars series about uh, infections generally, and we're talking about uh, hepatitis this time around. So, what is actually this hepatitis? Many people have different views of what this hepatitis is. Some correct, some are incorrect. So we're here to correct the misconceptions and erroneous views about hepatitis. All right. So this entity called hepatitis is actually, simply put, um, an inflammation of the liver. Okay, when the liver is inflamed from any cause, we say it is hepatitis. Hepatitis has many causes, ranging from infectious to non-infectious causes. Now, the world over 50% of cases are due to the viral uh, cause of hepatitis. There are other causes which I'll mention. Okay, so when we're looking at the infectious causes of hepatitis, we have viruses which can cause hepatitis. We have bacterial causes. We have protozoal causes and other fungal infections too that can cause hepatitis. When we look at the non-infectious causes, commonly we have drugs. Drugs commonly cause hepatitis. Alcohol. We have autoimmune diseases. We also have some metabolic diseases as well that can cause hepatitis. Now, um, going to the most common cause of acute hepatitis and even chronic hepatitis that we see, talking about the viral hepatitis. The viruses, there are several viruses that can cause viral hepatitis. Notable among them are the hepatitis B and hepatitis C virus. However, there are other viruses that can cause hepatitis. The hepatitis A virus, which causes a self-limiting disease. What this means is that on its own, the person will manifest symptoms and then get resolved over time. Okay, with uh, not necessarily taking drugs, but uh, the person can actually be observing some things or taking some things in order to allow the course of the virus pass through and then results on its own. Then we have hepatitis D. We also have hepatitis E. So these are the five common viruses that cause hepatitis, viral hepatitis. Hepatitis A and E cause self-limiting disease. Okay, on its own, it resolves. It's just like it's synonymous to the cause of catarrh. Okay, catarrh comes from time to time. Uh-huh. Now, hepatitis A and E are also similar to that. Um, on its own, even without taking medications, it resolves. Okay. However, hepatitis B and C can go on to cause chronic infections and even complications of the liver, leading to cirrhosis, liver failure, and eventually death. Now, having said this, um, I would really want us to know why the world is being focused about hepatitis. Hepatitis B in Africa has affected 60 million people, and over 200,000 people die of hepatitis B and C every year. So it's quite alarming. And majority of these infections are actually due to mother to child transmission and early childhood acquisition, usually under age 5. Now, why this is worrisome is because by the time these young individuals or children grow to reach 30, 40, and above years, they begin to come down with complications of hepatitis and eventually die. Now, the risk of chronic infection is 90%, so it's quite high when hepatitis B, occurs around the period of pregnancy and delivery in the life of a child. Okay. Um, the world has come up with a theme for this year's World Hepatitis Day. It is time to act. The theme is it is time to act. It is time to act because of the enormous burden hepatitis B is causing humanity. All right. Now, um, the symptoms of these hepatitis are also vary depending on the cause and also the complications that have set in. Now, for hepatitis A and hepatitis E, usually is acquired via fecal oral route, hand to mouth, okay, route of transmission. Somebody can take or can be infected with hepatitis A or hepatitis E through ingestion of contaminated food or contaminated water. Okay, when one drinks water in an environment that has uh, high hepatitis A incidence or prevalence, one could actually be infected, especially on clean water. Okay. Um, Again, such individuals will go on to have diarrhea, will have fever, fatigue, weakness of the body, and they may also have yellowness of the eye, what we call jaundice. Okay. Similar symptoms, just like uh, hepatitis E. All right. Now, for hepatitis B and hepatitis C, symptoms are also non-specific, but sometimes you could have specific symptoms of the liver. Okay, one can have fatigue, one can have fever, there may or may not be fever, and in fact, in most patients who have hepatitis, they are asymptomatic, meaning they don't even have symptoms, they don't exhibit or show any symptom of having viral hepatitis. Okay, so these individuals, unless they are tested, they may not know they have viral hepatitis. Now, for those who show symptoms, they can also have jaundice, yellowness of the eye, they can have fatigue, they can have uh, muscle ache, they can have abdominal pain, they can also have what we call right hypochondrial pain. The pain is usually located at the upper right part of the abdominal region. Okay, so sometimes this individual can vomit, sometimes their urine changes color. Okay, just like the eyes changes color, to yellow, their urine too changes color to yellow or becomes deep amber. All right, now these are the symptoms. Now when there are complications depending on the organ or the system involved, the complications could range, from altered consciousness when the brain is affected, to um, irrational talk or behavior, to abdominal swelling. You see a man with a big tummy as if he were a woman who is pregnant. Um, it is actually one of the complications called ascites, when the liver begins to fail or when the liver has actually failed. Now, these are late stage or complications of the disease. Okay, when we see that, sometimes the person has swelling of the legs, both legs. There are other causes of that too, but in the context of hepatitis or chronic hepatitis with complications, the person can have leg swellings, the person can have abdominal swellings or uh, swellings in the abdomen. Okay, now it is actually water in most cases that is building up in the abdominal cavity, and the person looks as if he's pregnant. Okay, um, these are the symptoms of hepatitis. All right. Now, how do we make a diagnosis of hepatitis? When somebody experiences fever, yellowness of the eye, stomach pain, especially at the upper right quadrant of the abdomen, such a person needs to visit the hospital and see a medical doctor. Okay. Now, from the interaction of the patient and the doctor can go ahead and request for some tests. Okay. After examining the patient to look at the sclera or the eye of the individual, whether they're yellow or not, to feel the patient's tummy, whether the liver is enlarged or bigger than normal or not, and then whether and how the liver feels, and whether there are some other changes, in the patient's body that would necessitate further evaluation of the extent of the disease. Now, the doctor can go ahead and give some investigations or some tests. Uh, Commonly, we screen for hepatitis, viral hepatitis B and C, through some strips. Blood samples of the patient is collected in the lab, and then they are tested using the hepatitis B strips and or the hepatitis C strips. Hepatitis C for strips for hepatitis B as hepatitis C in viral infection, and hepatitis B strips for hepatitis B viral infection. Now, when this test is positive, which will indicate by showing of two red lines, it means this person has been exposed to the virus. Okay. If the test is positive, the doctor will now go ahead and request for further investigations or tests to be able to differentiate the state of this infection. Is it an acute infection or is it a chronic infection? And then go ahead to also request for some tests, which will also tell us the extent of this disease. Okay, how far has the disease gone in the patient? It is important to note that this disease or this infection affects only the liver. Okay, hepatitis B is not found in the heart, in the brain, in any other part except the liver. Okay, so the liver is the primary side of infection. Okay, Now, this infection, when it affects the liver, there are other investigations or tests of the liver that will send the patient to do. Okay, some abdominal scan will scan the abdomen of the patient to see the nature or the texture of the liver. How is the liver? How are we seeing the liver on a scan? Okay, are there reasons for us to be worried or not? Okay, we can also take the blood samples of the patient to check for some markers, okay, whether this patient is beginning to develop cancer of the liver or not, okay. Then there are other high-tech investigations such as the fibroscan, okay. This tells us whether this liver has undergone some fibrotic change or some serious damage, okay, what we call fibrosis, okay. Now, or whether this patient actually has cirrhosis, okay, because fibrosis is one hallmark of cirrhosis, all right. So, depending on the degree or the stage of the disease, one would be able to institute some form of treatment. Okay, there is treatment for viral hepatitis. There is uh, there are drug treatments for viral hepatitis, but it is also important to note that for hepatitis B, there is no cure yet, but there are drug treatments for it, okay, to reduce the load of the virus in the system and to reduce the frequency and also the occurrence of fibrosis. There are some changes that occur in the liver as a result of the action of the virus, okay. Then for hepatitis C, there is cure for hepatitis C. Studies have shown that over 95% of patients with hepatitis C achieve cure with antiviral medications. Okay, even though some of these drugs are quite expensive and not readily available or easy to get. Okay, however, for hepatitis C, there is no vaccination as a way of prevention, unlike hepatitis B that has vaccine to prevent somebody from getting exposed or getting the infection. All right. So this is it. And this calls for everybody to take action, ensure that you get yourself screened. If you're exposed to the virus, another screening will be done in 6 months after that to be able to tell us whether this infection has been ongoing for some time in your body or not. Okay. And then do some other investigations to determine the extent of the disease and how best we can treat the patient. Okay. Having said this, um, it is important that children or pregnant women, when attending antenatal, have screenings for hepatitis B and C. Okay. Now, for hepatitis B, the mothers, uh, when they put to bed, there is usually the hepatitis B vaccine and the hepatitis B immunoglobulin that is given to the baby. Okay? The hepatitis B vaccine should be given within 24 hours of birth for the child, and the hepatitis uh, B immunoglobulin should also be given to the baby. Now, the hepatitis B immunoglobulin is a bit expensive, and the hepatitis B vaccine is free in most centers. Okay, sometimes you may need to pay a little token to get the vaccine done. All right. So this is just a brief overview of what hepatitis is all about, and in particular, viral hepatitis. So over to you, Bisola, so that we can entertain questions on hepatitis. Thank you very much.
Thank you so much. Thank you, Dr. Mashak, for that information on hepatitis. Thank you so much, and thank you to our viewers for joining this session. So now we'll be taking some of those questions. So we have a question here from Oha Machidi, which says, how can hepatitis B and C how can they be diagnosed, especially since they are uh, asymptomatic? People can be asymptomatic to hepatitis B and C. How can it be diagnosed? And also, we have another question from WhatsApp here, which says, how can I protect myself from hepatitis and how can it be managed? So, we'll start with these two questions. Before we continue to answer the other questions. So please, to our viewers, please drop in your questions. Dr. Mashak is here to answer our questions. So we're going to start with the two questions. So over to Dr. Mashak. How can you prevent yourself from hepatitis and how can it be managed? And also, how can hepatitis B and C be diagnosed since it's asymptomatic? So over to Dr. Mashak.
Okay. Thank you very much, Bisola, and thank you for those who send those questions. It's important. They're important questions. How can we actually make a diagnosis of hepatitis B and hepatitis C? There are screening tests that can be done. Okay. Submit yourself to any of the hospitals around and request for a test for hepatitis B and hepatitis C. The test doesn't take more than 5 minutes. They just take your blood sample, a drop or two of your blood sample on the strip, and then you exercise on patients. After about 3 to 5 minutes, the results will be ready. Okay. And the result is either positive or it's negative. Okay. So that is just a screening test. And if it is positive, it means that the individual is exposed to the virus. Okay. If there is hepatitis B, then it will be the patient will be counseled after the diagnosis is made. Okay. And then patient education ensues, and then address any concerns of the patient, and then also educate or tell the patient what he needs to do and what he needs to understand about hepatitis. Okay. Now, for hepatitis C, the test is basically the same. Okay. It's just that the test strip we use, one is labeled hepatitis B, surface antigen strip. The other one is anti-hepatitis C test strip. So the same process, a drop or two of your blood sample. You wait for about 3 to 5 minutes. The result is ready, and you get your result. Okay, it doesn't take time, and it is important that we subject ourselves, go to any reputable hospital or medical laboratory and get tested. Okay, remember, it is time to act. Now, to the second question, okay, how can we prevent viral hepatitis? Okay, for hepatitis A and E, we know that it is acquired through drinking contaminated water or eating contaminated food with the virus. Okay, try and avoid drinking water that is unclean or drinking water that you don't know the source, or if you are in an area that um, has hepatitis A and E infection, commonly, ensure that you observe hygiene and also boil the water before drinking. Okay. Ensure that you wash your hands properly when going to toilet or after toilet, and before you eat any food, ensure that you wash your hand with soap and water. So these basic preventive measures can actually prevent one from hepatitis A and E. Now, for viral hepatitis, if this person is a woman and she's pregnant and she already has a virus, then it is important that she protects her newborn, which is a baby. All right. How can she do that? She should present herself to any reputable hospital and have uh, register for antenatal. Hepatitis screen is one of the routine screenings we do for pregnant women. Okay. If she is confirmed to have viral hepatitis, especially B and C, she will be carried through with patient education and what she needs to prepare herself for during delivery or immediately after delivery, because she needs the hepatitis B immunoglobulin to be given to the baby, and also the hepatitis B vaccine. Okay, the immunoglobulin protects the baby immediately. All right, while the hepatitis B vaccine takes some few weeks, about two at, at least, before it begins to work in the baby. Okay, so the immunoglobulin is important for immediate protection for the child. All right. Now, if the patient or if the individual does not have hepatitis B or hepatitis C, how can you go ahead to protect yourself? Um, I didn't say this before, but there are ways one can get viral hepatitis. Okay, what are these ways an individual can get hepatitis B and hepatitis C, viral hepatitis generally? One, when somebody is exposed to the virus through somebody who is infected and there is fluid contact between the individual and the patient or the person with the infection, one can get the infection. Okay, blood transfusion using blood products that are unscreened or are not hepatitis B and C free. Once somebody is transfused with such a blood product, one can get infected with this virus. Thirdly, sexual contact. Okay, one thing that barrier contraceptives or barrier methods of protection helps or do is that it prevents not only pregnancy, but it also prevents one from getting viral infections. And it's not only uh, hepatitis B and C. There are many viral infections that one can, contract through sexual intercourse. Okay, so the use of condoms are preventive. Abstinence is also preventive. But if your partner is having the infection, of course, you don't go using condoms simply because you don't want to catch the disease. Okay, you should get the hepatitis B vaccine inoculated into you to protect yourself. Okay, so if you don't have the infection, simply go and get the hepatitis B vaccine, which will protect you. Unfortunately, we don't have the hepatitis C vaccine. It is not available in the world yet. So these are the ways one can actually prevent hepatitis B and hepatitis C vaccines. Thank you.
Thank you. Thank you so much, Dr. Mashak, for that. So we'll proceed to the other questions that we have here, which says, this question is from Amanda Unnaji. Are there strips available to common individuals? So I think she's trying to ask, there are test strips around, like, for example, pregnancy test strip that you can just walk into a pharmacy and just buy, take it home and test yourself. So I think she's trying to say, are there test strips like which you can buy available to individual for people to go home themselves and test for their results, hepatitis? Then also, the next question here that from Emmanuel Evans says, what advice do you have for caregivers of people suffering from hepatitis? So would answer these two questions as well before we move on to the other questions. Over to you, Doctor.
All right. Thank you, Bisola. Thank you for those questions. Are there test strips that one can use to test himself or herself at home? Yes. You can simply walk into any of the pharmaceutical stores and request for these strips. Okay. Or you can present yourself to any reputable medical laboratory or go to any of the reputable hospitals and get yourself tested. Okay. So just like Bisola has spoken, there are test strips similar to the pregnancy test strips. The hepatitis B and C test strips are something similar to that of the pregnancy test strips. Okay. You go buy them and then drop uh, your blood sample on the portion of the test, okay, on the strip, and then apply some buffer and then wait for this 3 to 5 minutes. And there you go. You see your result there. Okay. If it is one line, there is usually two lines. One is a test line and the other one is a control line. Okay. The control line always shows up. Okay. The test line may either be there or absent. So if you see one line showing, it means it is the test line. Okay, and it what that means is that the test is negative. You are not exposed to the virus. But when you see two lines, the test line is showing and also the control line is showing, it means you are exposed to the virus. Okay, when you see that, you quickly go to the hospital, not to any traditional medication or trado medical center to get yourself some herbs because they will cause more damage to your liver. Okay, so go to the hospital and then tell your doctor, this is what I observed. I screened myself and I saw two lines, for hepatitis B or for hepatitis C. What do I do? Then the doctor will put you through and in on what you need to do and what you need to observe. So on the second question, what are those things you need to do to support uh, families of people who have hepatitis B or C viral infection? Um, as a doctor, I've been trained to always show empathy to my patients. Okay. So if you have a sibling who has, or a parent or any family member who has hepatitis B or hepatitis in general, show empathy. All right. Be supportive. Do not discriminate against them. And do not try to stigmatize them. All right. Now it's an infection. It's a disease that one has acquired. Okay, one can actually be treated and be healed of it. Okay, even though some of these infections are chronic, lifelong, without any cure. Okay, but the infections are treatable. Okay, they are treatable, and you need to show empathy and support to individuals who have this infection. Again, these infections are not acquired through sharing the same bed with individuals who have hepatitis B or C. It is not acquired through sharing the same toilet. It is not acquired through using the same or eating from the same dish or pot. All right. It does not, one does not get the infection through sharing of spoons. Are we together? So do not discriminate these individuals or be scared of them and begin to avoid them simply because they have hepatitis B or hepatitis C infection. All right. I have stated earlier ways through which one can get this infection. Okay. Another way of getting this infection is through injection drug users. Using the same syringe, if I abuse drugs, I inject myself with some drugs, and then I give my friend, and my friend injects himself too with the same syringe, and I have hepatitis B. What I have done is given him, my friend, hepatitis B on a platter of, what would I say, gold now, or what? You understand? It shouldn't be. Okay, such habits and behaviors transmit hepatitis without the individuals knowing. Okay, but one cannot get by simply staying in the same roof, under the same roof, or sharing the same bedroom, or using the same utensils, or uh, sharing, personal items, like that. Okay, sharing the same towel or whatever. It's unhygienic to actually share towels, but some people do, especially in families. Okay, you see that a child is cleaned with the same towel they will use for, the other sibling. So these kind of things do not transmit the virus. Okay, so that's that, uh, regarding the answer to the second question. Thank you, Bisola.
All right, thank you so much, Dr. Mashak. Thank you to our viewers. Thank you so much for joining. So we'll move on to our next question now. So we have a question here from Abdi Aziz, which says, the first question says, does hepatitis C have a cure? And we have another question from Odnebo Angel, which says, can hepatitis lead to cancer of the liver? So we go with this two questions now. So I'm going to hand it over to Dr. Mashak. Can hepatitis lead to the cancer of the liver? And does hepatitis C have a cure? Thank you. Over
Thank
to
you.
you.
Very important questions. Yes, uh, hepatitis C has a cure. I said earlier that over 95% of individuals with hepatitis C get cured. Okay, only about 2 to 5% don't eventually get cured of it, or they are cured and then they get, reinfected again. Hepatitis uh, B does not have a cure, which is unfortunate. All right. But the good thing is that there is a vaccine to prevent hepatitis B, while there is no vaccine to prevent hepatitis C. You see the irony? Yeah. So, to the next question, hepatitis, viral hepatitis can be acute and it can be chronic. What this means is that one can be exposed to the virus and then the body is able to conquer it and the person is healed from it. Okay. Or on the other hand, the body is not able to conquer it. And what happens? The body remains infected with this virus. Now, when this virus stays for a long time in a person's body, it causes some damage to the liver. Okay. And it distorts the architecture of the liver. I mentioned the word earlier called fibrosis. It is one of those features of chronicity, okay, um, in viral hepatitis. Now, hepatitis B and C, both of them can cause liver cancer. Now, when one has severe fibrosis of the liver, one has cirrhosis. That's what it means, liver cirrhosis. Now, when liver cirrhosis occur, the next thing that happens is that the liver fails. When the liver fails, the person begins to develop features of such chronic failure of the liver or death that occurs, or the person will begin to show some symptoms that this person has developed cancer of the liver. Okay. Now, when cancer of the liver develops, there are other secondary sites that this cancer spread to. Could be spread to the brain, it could be spread to the spleen, it could be spread to surrounding structures, it could affect other internal organs as well. Okay. Now, once there is cancer, uh, one needs to begin to prepare for end of life. Okay. Unfortunately, there is no cure to it. Okay. Except there is liver transplant. If the person is lucky to have a liver transplant, the person would be sorry, the person will be able to have a transplant done, and then he's back to life. Okay, but again, liver transplant is difficult to get. Who would you uh, get his liver to transplant into you? If it were a kidney, uh, there are two. Every individual has, or most individuals have two kidneys. You can share one to somebody who needs, but the liver is only one. Okay, so one would have to get a liver transplant to be able to um, survive a liver cancer. So thank you very much.
All right. Thank you so much, Dr. Mashak, for those answers. So I'll be moving on to our next questions now. So for from Emmanuel Evans, he says, is the vaccination for hepatitis B easily accessible to the common man? Because it is one thing to have the vaccine and it is another for it to be accessible. So simply is trying to ask if the vaccine for hepatitis B is easily accessible to people. And from Angel, it says hepatitis B, is it proper for the vaccine to be given to a patient that is already infected? So a patient knows that he or she is already infected with hepatitis. Is it proper? Is it right? Can the patient still go for the vaccine even though the patient is already infected with the virus? And does it mean that the patient lives for with the virus for life? So we'll go with these two questions now before we go to our next question and also round up. So our viewers as well, please, if you still have questions, you can drop in your questions as well. Dr. Mashak is here to answer. So we're going to go with these questions for now. Is the vaccination for hepatitis B easily accessible to common man? And also, is it proper for a patient that is positive to get the vaccine regardless of the status of the patient? Thank you. Over to you, Dr.
Okay.
Mashak.
Okay. Thank you so much for this question. Um, for the question asked by Emmanuel, is this hepatitis vaccine readily available? Yes and no, and I will explain. Okay, for hepatitis B, the vaccine is readily available. Okay, for hepatitis C, there's no vaccine. For hepatitis A and E, is not readily available. It is actually a self-limiting infection, and it resolves even without taking any drugs. Okay, so what we commonly have in our environment is actually the um, hepatitis B and C. The hepatitis B vaccine is readily available. The even the hepatitis B immunoglobulin is also readily available. However, it is a bit on the high side regarding price. Okay, um, prices range between 70 to 100,000. Okay, depending on where you get it from and what brand. Okay, yeah. So the hepatitis B vaccine is readily available. One can go to any hospital, reputable hospital, and get 3 doses of this vaccine. Okay, at little or no cost. In some hospitals, it's given free. In some hospitals, you may have to pay a small token, uh, not quite much. Some 500 naira, some 1,000 naira, some up to 2,000 naira, depending on your environment and the the area you live. So it's actually available, and we have it readily, commonly available in the market in Nigeria. Um, to answer your question, Angel, the essence of preventing an infection using vaccine is, for one, to sensitize the body to prevent such an infection from entering the body. Okay. Um, if one is already infected, then the idea of getting a vaccine is already defeated. So it will not be wise to take the vaccine when you already have, or when somebody already had the infection. That would be more detrimental. Okay, if a person already has an infection and then is taking a vaccine for it, it's counterproductive. So I will not advise anyone who already has hepatitis B to go for the hepatitis B vaccine. Thank you.
All right. Thank you so much, Dr. Mashak. So the next question we have here is that, can an infected person with hepatitis B transmit it just by cooking for someone else? So because there's a myth about this, so I want to know how true it is. So can hepatitis be transmitted from someone that is positive with it? Can it be transmitted by cooking for other people that don't have hepatitis?
Okay. Thank you very much for this for this uh, question. Now, I would say uh, yes and no. Now, yes, if the person has hepatitis A or hepatitis E and is cooking for somebody, okay, the person can easily infect the food, because we know it is an infection or a disease that is transmitted through fecal oral route, or through the hand, or through what you eat or what you drink. So if the person has hepatitis A and hepatitis E, one would need to be screened, okay? Or one needs to be, certified free before such an individual can go ahead to cook. But for hepatitis B and C, and even D, cooking does not transmit the disease. Okay? Cooking does not transmit the disease. Um, However, if somebody has active replication of the virus in the body at the time, and then the person uh, does not protect himself sexually, okay, or the person uses any sharps, be it razor blade or needles, indiscriminately, and somebody eventually picks it up and gets himself injured, with the same sharps, then that person can actually get infected, but not through cooking. So that is it. Thank
All
you,
right.
Usman.
Thank you, Doc. So two last question. But before I ask this last question, I'm going to just remind us, just to let our viewers know that this asked me anything about hepatitis, which is to celebrate the World Hepatitis Day, which is celebrated every 20th of July. It's brought to us by Complete Care. Complete Care is a digital healthcare marketplace that connects patients and users with professional health care within the shortest period of time. So I'd be asking this last question from our viewers, which says, what type of food should someone with hepatitis eat, or what type of life should they keep?
Okay. Sorry. Um, what kind of food one should eat? Well, it depends on the stage of the disease. There are a lot of misconceptions as to what one should eat. One should either avoid certain kinds of food. One, a person has hepatitis B or hepatitis C. We don't restrict diets in people or individuals who have viral hepatitis infection, especially when the infection does not cause any form of damage to the liver. Okay. When it is a stable infection, a person does not have uh, liver cirrhosis, the person does not have some end stage disease of as a result of this infection, we don't advise a person to stop eating beans or proteinous diets or whatever. Okay. But if the person has already developed some serious complications of the liver from hepatitis B or C, and it's evident that the liver cannot process. The liver is the engine room of metabolism in the body. Okay, so if the individual cannot be able to, if the liver of such an individual cannot be able to take him through, we try to put some limitation to the kind of food such an individual eats, because it will end up overworking or overloading the liver. Okay, yes. So depending on the individual, we restrict diet, and then in some cases we don't restrict diet based on uh, the person's peculiarities. So that is that.
All right.
Thank you,
Thank
Lucia.
you. All right. So be rounding up this session shortly. But before we do
Okay.
that, Dr. Mashak, I would like you to, give us one advice, that you want us to take to. Just advise us. What do you think? How do you think everyone should live, or what lifestyle changes do you want people to work with, just to help them, to prevent not even only hepatitis, any infection at all, any viruses at all.
Okay. Thank you so much for that. If there's any message I want to pass tonight, is for people to ensure they take action. Visit any reputable hospital and get screening for hepatitis B and hepatitis C. Okay. If you are unable to uh, do that, ensure that you visit any reputable medical laboratory, or um, get in touch with a qualified medical doctor or medical lab scientist to screen you for viral hepatitis. Okay. Secondly, if you intend to get pregnant, you need to screen yourself. And if you have hepatitis B already, there is no cause for alarm. You don't need to be worried. You don't need to cry over it. You don't need to be disturbed about it. Okay, your baby uh, would be vaccinated against hepatitis B to protect your baby. So these are the advice. Okay, ensure that when you get pregnant you register for antenatal as fast as possible, and then let your doctor know that you have this particular infection and how you can go about it in the course of the pregnancy. Okay, for hepatitis B and C we always advise that people should ensure they observe topmost hygiene. Okay, hygiene practices, hand washing, ensure we eat healthy, we eat clean food, we eat clean drinking water. Avoid contaminated water or water from sources you don't know, and also food items that you are unsure of. It is better you cook your food, or if you're unable to, ensure that the food you are eating or you're buying is piping hot. Okay, not one that is cold, or the steam is not really rising from the food. Okay, so these are ways one can prevent viral hepatitis. Okay, so thank you very much for listening. Thank you. Over and out, Bisola.
Thank you so much, Dr. Mashak. I want to say thank you again to our viewers for joining us this evening for our live session, which is Start Ask Me Anything About Hepatitis, which is to celebrate the World Hepatitis Day once again, which is celebrated yearly on the 28th of July, which is tomorrow. So we would want to say thank you for our viewers. Thank you for staying with us from the beginning of the session to the end. We do hope that you got the information that you need. We do hope that we answered your questions, and we do hope that you join us on our next Ask Me Anything live session with our doctors. So thank you once again to our viewers for joining. Thank you, Dr. Mashak, for answering all of our questions this evening. See
Thank you.
you next time on our live session on Ask Me Anything with our doctors. Do have a good evening and bye.
Thank you.